what are your choices for what's inside the implants? Well, there's a saline or a gel implant. So this is a saline implant. So what's inside this thing? What it is salt water, but it's sterile salt water. It's the same fluid that, like, when you get sick and you go to the hospital, they run it into your system to make you feel better, to make you more hydrated. This implant, when you feel it, you can kind of feel the bag a little more easily because the way it feels, you may be able to feel a little bit of ripples on the side of it. If you're quite thin, you may be able to see ripples. So for that reason, most of my patients prefer this implant. This is a gel implant. So what's inside this implant? This implant has kind of like a jelly in it. It's more like a jelly candy. Like, for example, if you cut this in half, it would sort of make two pieces with a little jelly candy kind of stuff inside. So it doesn't kind of ooze out or drip out. It's more like a sort of semi-solid, kind of like flan that you would eat for dessert, or more like a gummy bear candy sort of thing. And so what's different about this implant than that one? Why do most of my patients prefer this one? When you feel the implant, it really kind of feels like breast tissue. It's kind of soft and it gives way real easily. And you can't quite feel the bag on it the way you can with the saline. And you're much less likely to sort of see rippling on it, and certainly much less likely to feel rippling on it. And that's why so many patients really prefer this implant. And even patients that used to have the saline implants that switched to these gel implants like them a lot better. The other thing is the look of this implant. This implant will look more natural. For example, when you lay on your back, it'll kind of come down a little bit like a natural breast, whereas the saline implant tends to kind of sit up more like a water balloon, if you will, because it really is sort of a water balloon, but a water balloon filled with sterile salt water, clean salt water. So that's the other thing about this implant is you can kind of see the edge of the implant tends to kind of sit up and a little more round. And that's why when you look at a patient with these implants, you're more likely to be able to see sort of a rim along the top of the breast, right in this area through here. And it gets a little more fakey look. Some people like the fakey look, and some patients come to me and say, hey, I want them to look really fake. And I said, well, if you want them to look really fake and you don't mind to be able to feel the implant a little bit more easily, then a saline might be a good option for you.